Hi everyone! Welcome again to my YouTube channel. My name is Alona. I am a nurse educator and lactation consultant. So today I want to talk about one of the most common issues in breastfeeding is the use of nipple shield. So based on my nursing experience and as a lactation consultant, I've encountered so many issues with co-nurses, with co-healthcare providers, as well as with mothers using the nipple shield. Now, if you haven't seen a nipple shield before, this is a nipple shield. I'm going to focus it really good into my camera here. So that is a nipple shield. As you can see, there is a curve around this square right in the bottom, and I'm going to explain to you what that's one for, okay? Now, nipple shield can fix breastfeeding problem. At the same time, it can also cause a problem. And I'll tell you one by one, based on my nursing experience and based on evidence-based research. There are many healthcare providers right now who have no complete ideas or information about the purpose of nipple shield. So what happened is, based on my experience in the hospital, there were moms or delivering women, before they gave birth, they check in, they come in, and they are bringing nipple shield with them, even before birth. The problem is, when they're bringing this one in our unit, normally, oftenly, they got the wrong size, okay? So I'm going to talk about the right size first, okay? When you look at your nipple, so when you look at your breast, when you look at your nipple, okay? This is very important. You need to pay attention to this because this is where the problem of nipple shield started. When you buy a nipple shield, you have to make sure that you look at the size of your nipple, okay? Ask your husband, ask your partner, or if you have a mother-in-law or mother to tell you if you have a small nipple, a medium-sized nipple, or a large nipple. Because the problem with the nipple shield, there are so many women, pregnant women, preparing for their breastfeeding and buying the wrong size and shape of nipple shield. So what are the sizes that you need to pay attention when you're buying this nipple shield? This is the largest size of nipple shield. This is 24 mm, okay, in diameter. The smallest one, based on my experience, there's 16 mm, there's also 20. In some brands, they have 22. Now, if you are not sure of what is the size of your nipple, either small, medium, or large, or extra large, because I've seen women with extra large nipple sizes, you need to guesstimate. I would suggest, if you are in that preparedness stage that you really want to have it before you gave birth, then buy the medium size, in the middle size, not the large one, not the small one. But if you can look at the mirror and said, I think the large size, if you look at in my thumb, see? My thumb, I have a big thumb, so that fits the large size. So look at your thumb and see if you can fit it. Now the problem is, when you buy this one, you cannot try it on, of course, right? So make sure that you tell wherever you buy the nipple shield that it should be either large, 24 mm, or 20 mm, or 16 mm. Now, there was a controversy on this sizes, and I've discussed this one with many of my coworkers because some nurses would tell you, buy the smallest nipple shield for a baby who is a preterm, okay? And before we go there, I'm just gonna go step by step why we're using it, why we need the nipple shield. We need the nipple shield if a woman has a flat nipple, inverted nipple, if the baby has tongue tied, if the baby cannot maintain the latch because again the latching is so weak, or if the baby refused to breastfeed, or the nipple is very sore or painful or cracked, the mother wants to use nipple shield to protect it, or if the mom has tons and tons of milk and she wants to slow down the flow of milk, she wants to use the nipple shield. It can also use when the mom wants to transition from bottle feeding to breastfeeding. That's why she used the nipple shield. It can also use for moms who stop breastfeeding for maybe weeks or months and want to relactate so that the baby will again fall in love with the breast. So some moms would use nipple shield when they feel very engorged because the baby cannot properly latch when they're very engorged, and sometimes their nipple is so painful. So those are the uses of nipple shield. Now, where the problem starts? The problem starts when you get the wrong size, okay? Why? Because when you get the wrong size, think about it. So this is the large size, as the thumb of my size, the size of my thumb. If you have a really, really small nipple and you're buying the large size, what happens is this shield will pinch your nipple, okay? Because the nipple itself in the silicone is not fully covered with the shape of your nipple. Now, if you have a large nipple and you have a small size of nipple shield, it can squeeze really deeply into your nipple and it cracks your nipple. So there was a discussion when I was working, because some healthcare provider would say, we want to buy a small nipple shield for a small baby. You need to think on this situation. The baby's mouth, the lips, the mouth itself can be stretched, but your breast size would never be, or the nipple size could never be stretched. It's always be either you're small, either you're large, or medium size. So if you buy a tiny little nipple shield because your baby is small, but yet you have an extra large nipple, what would happen to your nipple? Your nipple gonna be cracked, damaged, painful, and it's gonna be a discomfort. So you need to weigh things before you buy the nipple shield, because it's so much controversy going on, because again, not all healthcare providers are lactation consultant specialists, that they have all this knowledge on what's the right size for the right fit, for the right comfort for the mother. So it's very important that before, if you are pregnant right now, or if you are planning to get pregnant and you are preparing things and you notice you have a flat nipple, or you notice you have an inverted nipple, then you may have a problem. If you're pregnant right now and you're gonna be delivering a preterm baby, meaning baby that's only 36 weeks or 37 weeks, I've seen babies delivered 26 weeks, okay? So this, you may need a nipple shield preparation for the birth of the baby who's a preterm. So when preterm baby cannot latch, we use this, okay? However, there's a problem again. Not all preterm baby have all the energy or the strength to maintain a latch or sucking. So what I do, my tip is, sometimes mom feels very uncomfortable because when they put the nipple shield, I'm gonna just demonstrate it to you, okay? When you put the nipple shield, I'm just gonna demonstrate it. Some nurses would put this square cord right in the bottom. I want this square cord or opening right on top. Why? Because I want the baby to smell the milk. If I do this, putting this square cord or cut right in the bottom, yes, the baby's chin gonna be on the bottom, but the baby will not be able to smell the milk because the top portion of the areola is covered. So I want this square curve right on top so that the baby can smell the milk. And this is one of the conflicts that I've encountered at work, because not all healthcare providers are aware of this, on how to position the nipple shield. Now, if the baby has problem latching, especially for preterm, this nipple shield may not stick right into the nipple or the breast comfortably, or sometimes it flips up and down. So what I do is I use a tape. I'm just gonna focus it here, okay, because my camera is too far away. So I use a tape. You can use a tape. So what I do, so that this one doesn't move, I put it on the side. See? I put it on the side, and you can put another tape on the side. So when you're latching, okay, the baby, even if it's a preterm, the baby will be able to latch properly, and this one won't be flipped up and down, okay? And it stays where it should be, okay? So now again, when you're using this nipple shield, make sure that your nipple inside is not too squeezed deeply or too squeezed because the nipple shield is too small. Making sure that's why it's very important that when you buy a nipple shield, that you know what's the right size for you. And again, when you get the wrong size, you're gonna end up of either cracking your nipple, making your nipple very, very sore, and that causes more problems. So nipple shield is important to help the baby latch, okay? However, if you use this one all the time and not teaching your baby on how to latch without it, it becomes more problem. So I would like you to try this. If you really struggle with the latch right now, you can try getting a nipple shield, but make sure get in touch with breastfeeding or lactation consultant, because if you have no guidance using this, you may end up of cracking your nipple or making your nipple very, very sore, okay? What I do as well, another tip, when I latch the baby, especially those baby who are really, really weak breastfeeders, and sometimes they cannot get the milk right away, what I do is I spray milk inside the shield first, okay? I put milk inside the shield first, put it in the breast, in your breast, so the milk is there, right? So when the baby latches, there's already the flavor of your milk in there, and that initiates or that encourages the baby to latch or to breastfeed right away because of the smell of your milk. That's why it's important, wherever the square curve is, that's where the baby's nose goes, okay? And that's most mistake that healthcare provider does at the hospital, because again, they are not trained as lactation consultant, and they don't have enough knowledge about why we're using this, okay? Now, if you notice, okay, you've been using it for maybe 3 or 4 days, and you notice that baby sucking has improved, try to take it out, latch the baby without it. And if you haven't watched my latching video, please watch that, because you'll learn so many tricks, information about proper latching without the use of nipple shield. Again, nipple shield can fix breastfeeding problem, but it can also cause breastfeeding issues if you don't know or if you don't use the right technique that I taught you based on evidence-based information. So again, thank you for watching. Please share this video to so many moms who or women who are pregnant right now, so that they're gonna have some ideas on the proper way on how to use this nipple shield. Nipple shield is not cheap. It's a really expensive breastfeeding tool, but it can help. However, make sure you get the right fit and you get the right comfort. Bye for now, and thanks again for watching. Please like this video and share this video, and I'll see you again on more videos to come about breastfeeding and other nursing topic. Bye for now, and God bless.